Hello and welcome back to 90 Day Dental Day 35. We're partway through our perio program at the moment and it's going really well so far. Today is part 3. We're going to be concentrating on treatment planning and risk factors by Ian Dunn. One of the things I did want to mention and thank at this point, so I think it's always worth mentioning as we're going along, is how important our sponsors are and how much we appreciate them for having joined forces with us fairly early on. All of them have been a tremendous support and they've all been fantastic. Please do go and check them out. You've seen the logos at the start of the video and at the end of the video. Some of them are incredible academies, some of them are great products and designers for various different things. So really do go and check them out, and I really urge you to get on board with some of the things that they're doing and just thank them. Because without their support, none of this project would have been possible or doable. Anyway, Ian Dunn.
Hi all, welcome to the next in the series of Perio Top Tips. Today we're going to be talking about risk factors in perio, and I'm just going to give you some simple facts and figures that you can use when talking to your patients about their periodontal disease and specifically their risk factors. So we know that we live in harmony most of the time with our biofilm. Our host response is proportionate. And things can disturb this balance. We can have a disturbance due to increased bacteria levels or maybe even specific bacteria, but we can also have an imbalance, a move away from being at ease with this situation to a period of dis-ease by influencing the way the host responds. And there's lots of things that we know that can influence the way the host responds. And we know these to be risk factors. And when we look at lots of the risk factors that are available and the impact on periodontitis, we can see that the vast majority of them are actually lifestyle-based factors. And that's a really important point. When we think about risk factors, I like to think of it based on this quote by Beck. A risk factor is something that when you add it in, it is more likely to induce the disease, or the disease is more likely to be there. And when you take it away, then the disease is likely to get better or be absent. And so risk factors are a really important part of periodontitis management. We can think of them in a number of different ways. We can think about biofilm, genetics, smoking, diabetes, nutrition. There's lots of things that impact. Stress has been well researched, and we've also got some limited data for other chronic diseases, that things like lack of sleep or social isolation, lack of exercise, all these things can have an impact on chronic inflammatory diseases. There's limited data for this on perio. The way I like to think of it is, can I change it or can't I change it? And it's either modifiable or it's non-modifiable. And when we look at our list, there aren't many things on the list that patients can't change if they want to. And we should be looking to control as many of the modifiable factors as possible. There's some evidence that says that in terms of epidemiology, that this disease is becoming more prevalent. So we've got studies looking from Roman times. Only about 5% of Roman skulls that were recently investigated had periodontitis, and as many as 33% of aged matched patients had periodontitis in modern times. So we're sort of moving away from the Homo sapien and we're moving more towards Homo simpson. If we look at the big risk factors, so the biggie quite clearly is smoking, and smoking represents a really significant risk for periodontitis. So you're 3 to 7 times more likely to have periodontitis and for that disease to be progressive if you're a smoker. And smoking for me represents the single biggest modifiable risk factor if we take away oral hygiene being an etiological causative factor. Smokers need to be aware that this risk is there. They also need to be aware that they will respond less favourably to our non-surgical and surgical interventions. We often get asked about e-cigs, and we don't have a huge amount of data on e-cigs, but there's a few nice statements that came out. This is from the Professor Glantz from the Center for Tobacco Control and Research in America, and he said, in terms of gum disease, they are as bad as cigarettes, and you are bathing your gums in nicotine. Another paper that's recently come out has said that there's a slight increase in the prevalence of gum disease in patients who are vaping. We don't have huge data on this, but we have to see them as a positive, as in it's a move away from smoking, but ultimately it's probably still a negative impact on their periodontal health. The next big is diabetes. Nothing's really changed since most of you will have graduated. It's the unstable diabetic who is the problem. The question is, how do we know if someone's unstable with their diabetes? Well, we can ask them, we can screen, we can look for the patients who may not even know they're diabetic, because about 4 to 5% of the population are walking around with type 2 diabetes that don't know about it. So we're thinking about patients with a strong family history of diabetes, patients who are overweight, male, sedentary lifestyle. Asian males over 40, 1 in 5 have type 2 diabetes. So you can look at your patients and risk profile them and maybe think about referring 1 or 2 of them for further investigation. Then we've got data on things like nutrition. Some brilliant work come out of Birmingham University by Ian Chappell and his team, looking at oxidative stress and how certain food types are anti and pro-inflammatory. The basic message is that fresh fruit and veg are anti-inflammatory, as well as omega-3 oils, and things like refined carbohydrates and saturated fats are pro-inflammatory and will drive a pre-existing inflammation. Then we've got stress. Stress is very difficult to control. It is one of those things that we put down as a questionable modifiable factor, but we know that stress has significant impacts on general health and periodontal health. One interesting study, if you don't buy into the nutrition bit, this was a great study from Scandinavia. They took a group of patients and they put them into what they called a Stone Age environment. They took away all of their modern cleaning tools, so toothbrushes, toothpaste, mouthwashes. They gave them a Stone Age diet, and they measured lots of different things that both medical and dental when they went into this study. In terms of the dental, what they showed was that whilst the plaque scores more than doubled, which is what we'd expect because patients couldn't brush their teeth for a few weeks, their gingival inflammation barely changed. Their bleeding on probing actually reduced significantly, and pocket depths had a non-clinically significant change. But you've got a reduction in bleeding on probing in a group of patients who couldn't brush their teeth for best part of a month. And one of the arguments here was that this was due to a more hunter-gatherer lifestyle with less refined carbohydrates. Ultimately, all these things feed into oxidative stress, and oxidative stress is the sort of this imbalance where we get more free radicals than we get antioxidants, and that ultimately drives the inflammatory process. And it's the key pathological event that underpins all of our tissue destruction. Just to finish on a couple of points, there are a few controversies in this field when we look at risk factors and perio. So when we look at occlusion and perio, lots of people buy into the fact that occlusion causes perio or exacerbates perio. Now, we don't have any data. This was looked at the World Workshop that was done back in 2017. No evidence for primary occlusal trauma, and there's no good evidence for secondary occlusal trauma. Now, we all know that just because the evidence isn't there doesn't mean that there isn't an impact, but you should be aware if people are quoting studies on occlusion causing or exacerbating perio disease, that the evidence base is really not that strong. And lastly, hormones. We have mixed information on that from a periodontitis point of view, but it is worth noting that osteoporosis is one of the conditions I often get asked about a lot. We've got multiple studies that show postmenopausal women with osteoporosis get more periodontitis, but we also have studies that show they don't. So there's a little bit of a mixed message. I think in this big systematic review, one of the things they said was that it's not an etiological factor. It could affect the severity of a pre-existing condition, but equally, if we control the periodontitis through the measures that we know work very well, non-surgical or surgical therapy, tooth loss rates can still be very, very low. I hope that's given you a bit of an overview of the risk factors in periodontitis. There's lots and lots more that we could talk about in detail. Sadly, we can't fit them into these short soundbite lectures. I look forward to seeing you again soon on the next one. Take care. Bye.
Another cracking session of perio, and continuing with our perio theme tomorrow again. We're starting on the treatment phases. See you then.